Good evening, everyone. Happy Mother's Day. Thanks for those of you who are able to join us from your personal obligations. We figured that this would still be an appropriate time to have a town hall. And of course, it's going to be recorded so that people can watch it and listen to it later. But I thank you for those of you who are joining. Today's April 11th, and as always, I want to thank Terry and all those at the Lupus Foundation of America, Georgia chapter for helping us coordinate and help sponsoring this event, along with the Georgia Council for Lupus Education and Awareness and the Gold Project at Emory Rheumatology. As always, please keep in mind that this is not to be taken as direct personal medical advice to any individual, that you should always talk to your healthcare provider and team before you make any decisions for yourself. May 9th, not April 11th. Thank you, Scott. Must have the wrong slide there. So today is definitely May 9th, and we are definitely in always changing times, obviously, especially in the world of COVID. And this is cumulative infections over time, current active infections, and recoveries, cumulative recoveries and deaths. And so this is just over the course of basically the entire pandemic. And the US has always been at the forefront in terms of overall infections and deaths. The last time we spoke, actually, Brazil was number 2, but as you've been hearing in the news, there's been a tremendous spike in India, as well as other countries. But India has really been up there because of its high density and the sheer numbers of individuals at risk there, and the poor dissemination of the vaccines. So that's really led to huge numbers that's brought them to the honorable second mention here on the list, and things there just are not looking good. But as I mentioned, there are many other countries that are sharing the burden of COVID even to this day, despite how things may be appearing here. And so you can see the list here. But this is the hotspot map as it was last month when we had our last town hall. And so to remind you, this is not total numbers from the overall pandemic, but these are recently new infections, and the areas that are darker red or magenta are the ones that have the highest rates of current new infections. And Europe, South America, North America, and certainly India back then, and the Middle East were areas of great concern. And so going to now, you can see that it's still, to a large extent, North America, a lot in South America, still big numbers in Europe. You're talking Sweden and France and Spain to a certain extent, and Italy to this day, Turkey and Iran, the Middle East, Iraq has large numbers, Mongolia has been very big, and India, again. India has just been so crippled, again, because of the huge numbers, even though they have a pretty sophisticated medical system and vaccine production system, the largest producer of vaccines in the world. They're just not able to cope with the numbers. And they have a great social dichotomy, much like the US, in which the first wave was relatively well controlled by India, but the press and the journal news reports out there don't really talk about the vulnerable people as much. And the initial wave in India impacted the lower socioeconomic groups a lot, but it just didn't affect the other groups as much. And so that went relatively unnoticed. Well, actually, it was noticed that it seemed like India was doing a pretty good job, but now it's just full-blown outbreak throughout the country, and a large part of it has to do with the variants that have taken over throughout the world, just making it much easier to transmit and infect. And then on top of that, as I mentioned, they were just really slow to ramp up their vaccinations and other healthcare measures. But if you do know of anybody of Indian descent, and those other countries that I mentioned, please keep them in your prayers. And there's a lot of efforts trying to send help their way, international efforts, and it's good for us as a community over here to be able to assist throughout the world for people in need. So this is the U.S. a month ago in terms of hotspots. You can see Michigan, the Northeast, Minnesota, and then the panhandle of Texas, as well as Florida. Now it's cooled off, relatively speaking. You still see hotspots throughout Florida, the Northeast, Michigan, Minnesota, and here you're seeing some more in Colorado, and especially in the Northeast, back in Oregon and Washington. And if you wanted to put it into simpler colors, I guess the areas that are relatively spared are the most notable in my mind. You're talking about California and some of these other states, including some in our neighbors here, Mississippi and Alabama, but Georgia included. We've gotten much better, relatively speaking, but there's still a moderate risk of COVID throughout. And the highest risk remain in the areas that I mentioned before: Florida, Colorado, Illinois, Michigan, Minnesota, and then the Northeast. Now that was actually, I'm sorry, that was a month ago. And relatively speaking, it's still in those areas, but Michigan continues to stand out as really being highly active. The good news is that the other areas have calmed down a bit more, and you see more of the yellow areas there, which is good. Sorry, I got confused on the slides there. But I mean, this is echoing pretty much the trend that everybody's hearing about, right? You don't get the sense of urgency in this country, and that's because that not only has the overall reported cases throughout the US come down significantly from over the winter time, and seems to continue to be trending down, 29% decrease over the past 2 weeks, but the hospitalization rates have come down, as well as the death rate throughout the country. So when we talk about Georgia, this was a month ago. Big parts of the state with sort of low to moderate risk, including the metropolitan Atlanta area. You saw some areas back then where it was higher along the coast, and the south of Georgia, and around the Columbus area. Here recently, you're talking about pretty much similar pattern to what you see in the US. You see the same areas kind of lighting up, relatively speaking, but overall you see less of an impact in terms of higher average daily case rates, which is good. And again, looking at it sort of in a different fashion, you have reported cases are going down, and it's really sort of in the range of much earlier in the pandemic. And the hospitalization rates throughout the state have come down, as well as deaths. So news since the last month that we spoke, from the CDC, we're hearing that infections could be low enough that the pandemic can be under control by July, and that's a big if, but if we get most people vaccinated and continue to follow the safety guidance, that's going to make the biggest difference. And those who are fully vaccinated, the CDC has relaxed their guidance in terms of masking outdoors. that fully vaccinated people can abandon their mask when they're exercising or gathering in small groups outside, but they still advise wearing masks when they're in crowded outdoor venues or all medium-sized gatherings, whether they be outside or inside. And the news in terms of vaccines is that the new studies indicate that the Pfizer and Moderna vaccines are not only protective against the original strains, but the predominant variants that are out there, the UK and the South African variants. And I'll show you a little bit more about that in a minute. And even better news is that with this effective vaccine, we're going to be able to cover other parts of the population, especially the younger school age kids, 12 to 15. And a lot of people are saying that we should be expecting emergency youth use authorization for those 12 to 15 coming this week. And that's important because children make up 22.4% of new cases of COVID, and that's up 3% from a year ago. So that's still going to be the predominant passageway, if you will, for the virus to go throughout our community. And it's going to hit dramatic lows, I think, over the summer because the kids are out of school. But that's an ideal time to be able to get them vaccinated so that when we go back into the winter time and kids are in close quarters, we certainly don't want to be in a position where some of these countries, they've learned the hard way that things can rebound fairly quickly. And we've learned that ourselves in this country. Remember last summer, we thought that maybe the warmer weather, people being distanced outside, things could slow down, but it quickly heats up. So what makes a difference is the vaccinations. The White House is shifting their focus to vaccinate locally instead of these mass vaccination sites. And their goal is to hit 70% of the adults by July 4th. There was a story about, it was more logistical issues, that there were a lot of vaccines that just didn't get to people and had to be wasted, especially the ones that were going to these pharmacies. And a lot of it had to do with some logistics and planning hurdles and just the complexity of the fact that, who knew that the demand for vaccines would go down so much so quickly. So hopefully we will get that ramped up again and get the remaining people as much as possible vaccinated. Now, we need to focus throughout the world, obviously, and there's a vaccine that was approved by the WHO from China that will allow another source of vaccination for hopefully some of these resource poor countries throughout the world to get better access. So the Biden administration supports international efforts to waive intellectual property protections against the COVID vaccine. So in other words, get rid of the patent protections against that surround some of these vaccines, that allow the other manufacturers, other countries to be able to produce them. But it's not as simple as it sounds. I think how that translates to actually going into production facilities and getting it into the arms of people who need it is going to take much longer than just a few months. So hopefully this will have an impact down the road, but unfortunately, from what I'm reading, it's a much complex issue. It takes a lot of time to put this into effect. There's questions as to what does this exactly mean, the details, and obviously some of the pharmaceutical companies are pushing back. So it's good that we have other vaccines available anyway. This is a study that came out of the Journal of the American Medical Association. It's talking about the vaccination with the Pfizer vaccine and just how amazing the vaccine has worked. This is looking at time going from left to right. And these two top colors up here, these lines that are going up, is the higher the line going up, the higher the rate of infection from COVID. So as time goes on, these two orangish lines are those that are unvaccinated, those that are symptomatic, and those are going to be the most infectious. So people who get symptomatic COVID, if they're not vaccinated over time, there's a really high rate of increased number of infections. And then as well as asymptomatic people that are just carrying the infection without knowing it, that's going to obviously go up. But when you're vaccinated, both symptomatic and asymptomatic individuals are at a very, very low level, and it stays flat. This is what's really making a huge difference. And this is why you're not seeing the urgency in our local news. We're not hearing about the hospital crush that's impending and the lack of equipment and the PPE that's out there. So these vaccines are working. And not only are they working as originally designed, they're working against the variants. This is a New England Journal of Medicine article out of Qatar, and they're looking at people who received 2 doses of the Pfizer vaccine. They were 90% less likely to develop an infection by the UK variant compared to those who are unvaccinated. And they still had a really strong effectiveness against those with the South African variant. And the South African variant is thought to be more problematic than the UK variant, has a very strong protection against infection. But not only that, it's basically been completely effective, almost completely effective, greater than 90% effective in protecting against hospitalization or death of the South African variant. So we were concerned about some of these main variants, and there will continue to be ones that come out that we're concerned about, but the ones that we know that are pretty dominant in this country, as well as throughout the world, our known vaccines are effective against that. So just to give you an idea, in Georgia, the UK variant is about 65% of the viruses that are being genotyped or tested for their genetics as to what type they are, and 2.5% are the South African variant. And because of these variants, those who are getting vaccinations are protected, but will probably need some sort of booster shot. And this is some data out of Moderna that having a booster and exactly how long after the first shot, that's still kind of being thought through, but a booster shot increases even more the protection against some of these variants. So most people feel that at some point down the road, we're going to have information to kind of give us an idea as to at what point people who've gotten vaccinated should get another booster shot. As all of this has sort of been playing in the background, I think part of human nature is to just feel a bit overwhelmed and kind of you just don't really pay much attention to it as much, and that is understandable. But as I mentioned earlier, the vaccines are clearly effective, and they've clearly brought down the infection rate as well as the hospitalization and death rate. So it's not a surprise that people are feeling as though the door is opening, the light is coming through, and that we're getting closer and closer to quote unquote normal. And this has been panning out in some surveys being done throughout the country, and the trends are for people to start feeling more like that. This is one national survey where it said about 2 in 5 millennials feel very concerned about COVID-19, and that's come down a lot. So in other words, 3 in 5 millennials, more than half, are not as concerned, or they don't feel it's of high concern. And only about a quarter of individuals, US adults, view COVID-19 as a severe health risk locally. And over 3 in 5 millennials are comfortable with return to regular routine. So again, thanks to a lot of the public health measures, what people are doing individually, with a huge boost by the vaccine, we've gotten to the point where there are a lot of good aspects and good numbers and people are starting to feel optimistic, as this is showing, as well as I'm sure a lot of you are feeling and maybe seeing around you. Um, put though into context, again, I do think there are some people that are just constantly doom and gloom, but I do think that a lot of what is out there is great promise, and I think we can be more normal in a lot of parts, a lot of the parts of our lives. The small gatherings and being able to visit family that are fully vaccinated without masks and being outdoors. And I even hear that Fauci is given that some of these promising numbers of vaccinations, that again, vaccinations are the key, that there may be guidance to be even more allowable in terms of what you can do without masking. But that's really the key, is what is going on locally or regionally with the vaccines. The vaccinations are what is allowing the background rate to be low enough to be able to open the door for these things. And all the mention of national numbers going down has pretty much borne out in most areas, obviously, throughout the country, but not all. And we have to keep that in mind. One thing to keep in mind, at least in our area, is that we still have a fairly high rate of deaths in Georgia. I mentioned how the death rates earlier were going down in Georgia, and that's true. But relative to the rest of the country, we still actually have a fairly high rate of deaths. And so if you look at rankings of new deaths per 100,000 due to COVID, being low on the list is bad. So we're actually dead last. So in other words, we have the highest rate of new deaths per 100,000 of any state in the country. And so how do you reconcile all this in terms of, well, overall deaths are going down, maybe not as fast as the rest of the country. The infection rate is going down. Hospitalization rates are going down, and there's no trouble in the hospital. We don't know for sure, but as I mentioned, vaccinations are the key. Vaccinations, vaccinations, vaccinations. I think the more the people around you are vaccinated, the safer you're going to be. And the reality is that the country looks very different in terms of, at least locally or regionally, what that looks like. The darker the colors, the darkest is where at least half of the individuals have gotten at least one COVID vaccine shot. So the dark areas are in the Northeast, and you see in California and New Mexico. And then the lighter areas, you're starting to get to less than a third. And Georgia is there. And we're very, very low on the list of vaccinations. And I think a lot of people, myself included, think that that's how you explain, at least in large part, what we're mentioning. Everything's getting better in terms of numbers, but we're still very high in terms of the death rates because we're not getting the vaccinations done in our area. There's enough to drive the rates lower, but not enough to prevent new infections in highly vulnerable people that will get them very sick very quickly. So it's not overwhelming the hospitals, but the numbers are still there. And if you rank all the states, Georgia is somewhere towards the end there. It's like right here in terms of vaccination rates. So I just wanted to put in the context of all the other states. We're sort of at the very bottom tier. In terms of usage of available vaccine supply, we're number 48th in terms of the states, in terms of using what we have available. The average is 79% in the US. We're only using 68% of our supplies. In terms of doses on hand, we have a lot. We're number 3. We've got a lot available. We're ready to stick people in the arms, but they're not coming. The total of the population that has at least one dose, we're talking about 35%, which is 44th in the country. And then who are fully vaccinated, only a quarter in Georgia. which is number 46 in the country. And these are the percentages, average percentages in the rest of the US. The adult population, we're 44th and 47th in terms of at least one dose and fully vaccinated. And then in terms of the elderly, 65 and over with at least one dose or fully vaccinated, we're number 42 and number 45. So I'm not happy with that. I'm happy with how things are going throughout the country, and we're headed in the right track. I'm happy that businesses are opening up. I'm happy that people are feeling better being outside. But relative to the rest of the country, we're doing a very poor job, and there's no outrage about that. We could be doing so much better, and yet, a lot of the people in charge are acting as if it's okay, but we could be even better. And as Georgia, we shouldn't just always feel like, okay, yeah, we're in the South, we're sort of always low in some of these outcomes. What's it going to take before we get we say enough? We need to improve all of this. Many of you are familiar with GOAL, our study. So I thought I would just review really quick and show you some results from what we've had in a recent COVID survey that many of you have helped give us these results for. To remind you, the CDC funded the Georgia Lupus Registry to identify everybody in the early 2000s with lupus in Fulton and DeKalb counties. And it was a very important epidemiology project in the US, only one of 5 registries in the country to do so. From that, we formed GOAL, Georgians Organized Against Lupus, where we contacted everybody from this registry and asked if they would be willing to join us in an effort to continue to learn about lupus, at least have an annual survey to fill out. We've supplemented this group with recruiting people from Grady, Emory, and a variety of community practices. And so over time, we've had well over 1,000 individuals with lupus, with a whole host of different severity of lupus across the socioeconomic spectrum, that have been so generous in their time completing surveys that help us learn about all different aspects of how lupus affects you. We've been able to collect genetic and other scientific information in some people. We've had some sub-studies that looked at that. We've matched to other databases to look at outcomes of the large group. So what I want to show is, and I'm sorry I didn't have time to make this sort of easier to read, but I'm going to walk you through it. We did a survey a couple months ago. These are results by the end of March. And it started at the height of the stay-at-home orders in Georgia, so early in the pandemic. And these are responses from 732 individuals at that time, up until that time, from GOAL. So of these 732, the average age was 51.4 years. You can see the distribution of individuals, about 15%, 110 individuals, or 15%, and this is how you read it, are between the ages of 18 to 34. 43% were between the ages of 34 to 54, and 41% were over 55 and over. People on average have had lupus for about 18 years, but it ranged from 1 year to 56 years. People were diagnosed on the average age of 33, but it ranged from being diagnosed at age 7 to age 70. 6.7% were male, 93.3% female. The vast majority of the individuals in our cohort self-identify as primarily Black. 21.9% were non-Black. The vast majority are white, non-Hispanic. We do have some Hispanic and multiracial individuals, but this is how it the predominant groups. So we just kind of put them into two groups for this analysis. You can see the amazing impact that lupus can have over time on individuals. So you look at current household income, 16.1% report an income of less than $10,000 a year. And if you combine that with this group here, 34%, so more than a third make less than 20,000. And if you look at the federal poverty level, so if you're one individual, the federal poverty level, I think was around 20,000 or so, but it's a very low cutoff. And unfortunately, about a quarter, more than a quarter of the gold cohort are people that are very impoverished. 40% are working, more than a third are unemployed, and this 23.3% are off the workforce for a variety of reasons. In large part are disabled, but there are some who are either retired or students or homemakers. And I can share different aspects of this survey, but I'm going to share for this session anyway, just two portions of the survey. And what we use are well accepted in the scientific world in terms of surveys that are validated. And by that I mean, these are surveys that have been tested in different groups. They have been shown scientifically to measure appropriately certain aspects. You may not completely agree with how things are worded, but we had to stick with how they were made for the survey, and it does provide some strength in terms of being able to compare our results with others. Studies that have used these questions, which is why one reason why we try to use these validated instruments. But this survey here is called the Vaccination Attitudes Examination, or VAX survey. And it's been used a fair amount, especially during the COVID period in a variety of different situations. There's one question here. I'm going to go through different questions, and you can see how people responded overall, and by gender, male or female, by race, Black or non-Black, and by different age groups. So to start, the first question is, I feel safe after being vaccinated. And people who took this survey could respond by identifying a number 1 through 6. And if you strongly agree, you would do 6, strongly disagree, 1, and if you're anywhere sort of in between, you would kind of pick the appropriate number. So I feel safe after being vaccinated. And about, let's see here, if you take these two here, 5 and 6, you have 35%, or about a third, would feel safe after being vaccinated. But on the other hand, you have a third on the other end of the spectrum that strongly disagree with that sentiment. Now, if you look at by gender here, and some of you may not know what a p-value is. It's a statistical tool that will give you a sense whether the different numbers that you see are between the groups are statistically significant. Is it more than just chance that numbers in different groups are different? And the cutoff that we use is less than 0.05. If it's less than 0.05, we do think that the differences between groups are probably more than just chance. So here you see that it is not less than 0.05, and so there really wasn't much of a difference between men and women. But you do see that it was much lower than 0.05 between Blacks and non-Blacks. And you can see here in terms of strongly agree for feeling safe after being vaccinated. In the top group here for Black individuals, about 32% feel that, strongly or relatively strongly that they feel safe after being vaccinated. which is a third, but it's much less than the non-Black group, which is 50%. So there seems to be less sense that there's safety in terms of the vaccination. And there's difference in groups too of ages, that over here fewer younger individuals feel safe compared to older individuals. And one thing I wanted to say before I go a little further into the survey is that I'm not doing this as a judgment for any group here. I thought this would be very eye-opening for us as a community to know how our community feels, and I think that the entire spectrum of feelings should be validated. And so I'm not doing this to point out people that need to be changed or corrected, but I think as we move forward together as a lupus community, we kind of need to know where we as a group stand so that we can be more effective together. So the next question is, I can rely on vaccines to stop serious infectious diseases. And so about over a third feel pretty strongly that they can rely on vaccines to stop, but a quarter don't feel very strongly that vaccines stop serious infectious diseases. There was no difference between men and women. There was, again, more of a sense in non-Black individuals that vaccines can stop serious infectious diseases. And again, it was more the older individuals that felt like vaccines were effective against serious disease, whereas if you were younger, it wasn't as much sense. I feel protected after getting vaccinated. About 40% feel strongly protected, but about 25% would not. Again, no difference between men and women. Black individuals felt less protected after getting vaccinated. And again, older individuals felt more protected after getting vaccinated. So this question here, although most vaccines appear to be safe, there may be problems that we haven't yet discovered. Many people feel strongly about that there are problems that haven't been discovered in the vaccines. In fact, 63%, 2/3 of our lupus community that the goal surveyed feels very strongly that there are problems that we haven't yet discovered. No difference between men and women. It was felt more in those who were Black compared to those who are non-Black. And let's see, no difference in age. So to the question, or to responding to the statement, vaccines can cause unforeseen problems in children. It was kind of fairly even throughout. You can see here, 11%, 16%, 21, 17, 13, 18%. No difference between men and women. It's not less than 0.05. There was a big difference. If you're Black, there was a higher chance that you had a strong feeling that vaccines can cause unforeseen problems in children, and really no significant difference between different age groups. I worry about the unknown effects of vaccines in the future. A good 50% of you do worry about that. No big difference between men and women. More people who identify as being Black felt strongly about worrying about unknown effects of vaccines in the future. There was no difference in the age groups. Vaccines make a lot of money for pharmaceutical companies, but don't do much for regular people. I would say about a quarter, 27% felt that that was true. A third felt pretty strongly that it was not true. There was no difference between men and women. If you were Black, there was a very strong sort of feeling that the pharmaceutical companies are more out for money. And there was no difference between age groups. Authorities promote vaccination for financial gain, not for people's health. So about 20% of people felt that way, but that was, they agreed with that statement. No difference between men and women. More of a suspicion about authorities promoting for financial gain in those who were Black, and no difference between the different age groups. Vaccination programs are a big con. Only about 11-12% felt fairly strongly about that statement and agreed with it. There was no difference between men and women. More people who are Black, about 13-14% compared to 3% or 4% felt that way. And vaccination programs are a big con. More of the younger individuals felt that way. About 15-16% of those who are 18 to 34 versus smaller numbers in the other age groups. And that was statistically significant here. Natural immunity lasts longer than a vaccine. And about 17% of you overall felt strongly about that. No difference between men and women. There was a difference between Blacks and whites and non-Blacks, and in that about 20% of Black individuals with lupus felt that natural immunity lasts longer than a vaccine, compared to about 9%. This just met sort of the threshold of less than 0.05. So it seemed like there was a trend towards younger individuals feeling that natural immunity lasts longer than vaccine compared to the other groups, age groups. Okay, natural exposure to viruses and germs gives the safest protection. So again, this natural thing, as opposed to having a vaccine put into you. About 19% of people, I'm sorry, I take that back. Only 10% felt that natural exposure gives the safest protection. There's no difference between men and women, Blacks and non-Blacks, and different age groups. Being exposed to diseases naturally is safer for the immune system than being exposed through vaccination. 10% of people felt fairly strongly about agreeing with that. No difference between men and women, Blacks and non-Blacks, but the younger individuals felt generally more inclined to be naturally exposed than going through a vaccination compared to the oldest age group. So I'm going to do one more survey type. This is a survey that we included in our last goal survey called the Vaccine Beliefs Survey. You can see, my religious beliefs prevent me from taking a vaccine. Only 4.2% had a religious prevention from taking the vaccine. There's no difference between men and women, Blacks, non-Blacks, but there was more of a religious exemption, if you will, in the youngest age group. people with lupus should get vaccinated against COVID-19. And this is out of 1 through 5, from strongly disagree to strongly agree. So people with lupus should get vaccinated against COVID. About half of the individuals in the overall group felt that way, agreed with it. Looks like more men than women agreed with that, felt that people with lupus should get vaccinated against COVID. More non-Black individuals agreed with that statement, and more older individuals agreed with that statement compared to the younger age group. People with lupus have more vaccine side effects than other people. About 19% agreed with that statement. Overall, no difference between men and women. There were more people that were Black that felt that people with lupus had more vaccine side effects than other people compared to non-Black individuals with lupus. And again, the younger age group agreed more with that statement that people with lupus have more vaccine side effects than other people. So next question is, the COVID vaccine will cause my lupus to flare up. 16% agreed with that overall. No difference between men and women. More Blacks agreed with that, and more of the younger group agreed with that. COVID vaccine will interact with my lupus medications and harm me. About 12% agreed overall. No difference between men and women. 14% agreed with that who were Black versus 4.4% who were non-Black. And younger individuals felt that there was more of a harm. Lupus medications will not affect how the vaccine works. So 22% felt that lupus medications will not affect how the vaccine works. No difference between men and women, or Blacks and non-Blacks. And it looks like it was kind of skewed more towards older individuals feeling that lupus medications will not affect how the vaccine works. So I'm going to go a little faster here. The COVID-19 vaccine is not as effective in people with lupus as in other people. Only about 8% felt that way. Again, more Blacks felt that way, and no differences in the other groups. People with lupus are at higher risk of getting COVID. And a lot of people felt that way. About 55+% felt that way, and no difference between any of the groups. The COVID vaccine will protect me from getting infected. 29-30% agreed with that. More men agreed with that. More non-Blacks, and older individuals. After I get the COVID vaccine, I can stop wearing a mask. So only 2-point-something% of people felt that way, and these are pretty small numbers, so no big differences in the major groups, basically. Because I already had COVID, I do not need the vaccine. 3.6% agreed with that statement. And looks like more of the younger population agreed with that than the older. I will get the COVID vaccine only after discussing my concerns with my lupus doctor. And that's 44%, with no major differences in any of the groups. I will not get the COVID vaccine even if my lupus doctor recommends it to me. So about 16% are just dead set against not getting the COVID vaccine. No difference between men and women. There were more Black individuals that would not get the vaccine no matter what, and more younger individuals. And lastly, I will get the COVID vaccine regardless of what my lupus doctor recommends. So these are people who will definitely get it come hell or high water. So 18% will get it no matter what. No difference between men and women. More non-Blacks would get it, and more older individuals would get it. So I'm sorry it took a little longer than I thought, but I thought you might be interested in how the rest of the community was feeling, and kind of the value of what we can get through goal. And by the way, we're hoping, we're doing some piloting to expand it to other parts of the state. So hopefully we can get more of our citizens throughout Georgia and really get a handle of how lupus is impacting the citizens of our state. And that's being spearheaded by the GCLEA. Lastly, just a reminder that as things are getting better in terms of infections overall, there's still the deadly toll of the inequality that the virus has had. That Black, Latinx, and Indigenous people are about 3 times as likely to be hospitalized and twice as likely to die from COVID compared to white non-Hispanic individuals. And the pandemic has the potential to widen the economic equality. Lupus already has widened this economic inequality. And I think, I know COVID is just an accelerant on that. It's pouring fuel on the fire, and it's going to widen it even further. And that's something that we need to keep an eye out for and help each other as we get through this as a community. So I'm going to end by just reminding you of the amazing resources that Terry and the group there at the Lupus Foundation of America Georgia chapter has put together. They've linked to the resources in the national website. Keep sending your questions when we meet to info@lfaga.org, no later than, I think, 2 p.m. the day of. We will continue to meet on the second Sundays, as long as you feel that it's been helpful to you. And happy Mother's Day. This is a picture of my mom, and she is the major factor that I've got interested in lupus. If you didn't know, she has lupus herself. She's taught me a lot about the condition, the impact of it, but also the strength and resilience to get through it. So we're reminded that there are many mothers who disproportionately bear the burden of lupus, who have also taught us a lot and got us through it with their strength. But also many I know who have left us all too early, or have not been able to give as much as they could and should have. So we dedicate this Mother's Day for all the mothers out there, for those who have lupus and the caretakers, for others. And we'll continue to fight so that you may have a better life in the future. So with that, thank you for your time, and be safe.